The Newton's AI is designed by the doctors for the doctors. It has multiple assistants including OPD assistant, drug interactions, emergency medicine treatment planner, patient simulator, and a NEET PG MCQs help assistant, an ICU assistant, and radiology assistant. You can also build multiple agents in Newton's AI, but we'll talk about that later. Here is a case of 25-year-old female with a pain abdomen and pervaginal bleed with clots since 2 days. Let's see how a OPD assistant interprets this case. The OPD assistant segregates the complaints into relevant and irrelevant parts. For example, if there is a irrelevant history such as myopia or anything, it will keep the myopia in the irrelevant section and focus only on the relevant information, and then it will ask the questions to be asked in history taking, and along with each question it will give diagnostic heuristics, which are the mental shortcuts that experienced doctors will have. For example, in this case it is asking for LMP because if the menstruation is absent in previous few months, it could suggest of pregnancy related complications. These are the shortcuts interpreted as miscarriage or ectopic pregnancy. So this is a case of ectopic pregnancy. Okay, so then it will suggest the tests that are needed to be done along with the priority of the each test and the diagnostic heuristics for the each test. Okay, here it asks for the UPT because if it is positive, it suggests that it is either miscarriage or ectopic pregnancy, which are the complications of pregnancy. Okay, and then in the differential diagnosis, it will give the differential diagnosis with the confidence scoring for each diagnosis, which is similar to the probability of the each diagnosis. This confidence scores keeps on changing as we enter more history. For example, let's say we give UPT positive. Let's see how the confidence scores and the differential diagnosis changes. Here it increases the confidence scores of pregnancy and remove the non-pregnancy related causes. Okay, and it suggested the ultrasound which will diagnose whether it is a threatened abortion or it is an ectopic pregnancy, and also beta HCG quantitative to analyze ectopic pregnancy. Okay, and then there is the immediate treatment plan, and the book it is deriving the treatment plan from. Okay, it will give the day-wise treatment plans. First it is asking for us to stop the bleeding using tranexamic acid 500 mg dosage and for 3 to 5 days. Okay, if the bleeding still persists, we can go with surgical interventions. So if the ectopic pregnancy is confirmed, we can go with the methotrexate I suggested.